to our, I'm going to say it's our October health series. And I'd like to introduce Annette Anderson, and she's here from CVS in Medfield. She's a pharmacist there, and you have an outreach role also?
I have an outreach.
Yes, so she actually, and I just spoke with her, she's going to come in and do a talk on in the future on Coumadin and the new anticoagulants that they have out there, if anybody's on that. So that's something to look forward to. So I'm going to turn the mic over to Annette, and she's going to talk about the shingles.
A yummy after lunch topic. I'm really sorry. So so my name's Annette. I've been a pharmacist for 24 years, and much of my career has always been about helping people get over a disease once they've already had it. I'm very passionate about this topic because I can actually help prevent disease and help people prevent from feeling ill. So I really like that piece of my job. So by a show of hands, real quick, how many people have had the chicken pox or know that they've had the chicken pox? Yeah. About 98% of the population has had chicken pox. And the virus that causes chicken pox is the virus that causes shingles. Once you have the chicken pox, that virus is already in your body, so you are already at risk. Before you're even the precious age of 18 years old, you're already at risk for the shingles. So the shingles, what happens with the chickenpox virus is it's really tricky, it's really sneaky. Typically our immune system will clear a virus. We'll get a cold, it'll clear it, it'll be gone. The chickenpox virus, that's a tricky little character. It has figured out a way to live in our nerve root, and it's called the ganglia. Really fancy term, you don't need to know it. Just know that it's sneaky and it's living in this little pocket in your body at the end of your nerve endings, particularly around your spine and in your head. And for some reason, and they really haven't figured out why, it's figured out a way to live in there really sleepy-like. It's really not doing much to trigger the immune system to pay attention to it. We're not quite sure how it does it. If we figure it out, then maybe we'll be able to stop it a little bit better. But it's lying there dormant. So years later, it's living in your body and you're having a good old life and things are going along fine. And as we age, we all know things just start going downhill at some point, along with our immune system. It isn't as strong as it used to be. So the immune system's weak. We got this little character living in there dormant, ready to start causing trouble. And all of a sudden, for some reason, and again, they're really not sure what triggers this virus to pop out again, it starts to come out. And you're at real risk after the age of 50. And that's when your immune system really starts to weaken a little bit. So your immune system's weak, this virus pops out, and it travels along your nerve root and causes these really painful shingle-like rashes on your body, typically on the trunk or on your head. That's why it's called the shingles, because of the way that it looks. And they're very painful. The chickenpox rash is itchy. It causes death of some of your skin cells, and as they're dying and deteriorating, you get very itchy. This is pain along your nerve root, so you feel it all the way to the core. Is there anybody here? I thought, was somebody here suffering? Still, yeah. 6 months, yeah. So is it?
You know what's frustrating to me is that so many people have it, but nothing is being done about it. No doctors seem to be studying it or to come up with a medication that will stop the pain. I have been on, I can't tell you how many different pain pills. Nothing touches it. Just time.
Yeah, it is frustrating. I'm sorry. You've had the shot 4 times, or? You've had shingles 4 times. Yeah, unfortunately, unlike the chickenpox, which very rarely do you suffer from it again, you can get the shingles again. So, I'm sorry, go ahead.
I understand right that if you have had shingles, you can't get them again.
Yes. Yeah, that's why. So part of the talk, the beginning of my talk is going to be on what is the disease, and then the second part will be what can we do to minimize it. And to your point, curing it, They really, so viruses are different from bacteria in that they take over our own cells and they use our own cells as machinery. They haven't figured out a way really to kill the virus without killing our own human cells. So good news, we can kill the virus. Bad news is we kill the humans, and we really don't want to do that. So that's why it's so difficult to cure viruses. We've found antivirals where we can mitigate it and help our body until our body fights against it. And then as far as the pain medications go, they're doing more with neurologically based pain, which is what this is considered, pain that travels along the nerve root. And what they're trying to do is stop that pain transmission. So a lot of the medications that they have sort of work in your central nervous system to stop the pain transmission. For some people they're effective, for some people they're not. For some people they cause a lot of side effects, dizziness, drowsiness. Then you're at risk for other complications. If you're dizzy and drowsy, you might fall. So there's just, it is very, very, very complicated, and it's not such an easy fix, unfortunately, because you are dealing with these tricky little buggers who just love to mutate and hide and do everything they can to trick us. So unfortunately, hopefully they will come up with something more. Yeah.
Research is done.
Yeah.
I don't care about them killing the nerve endings, just stop the pain.
Stop the pain. Yeah, yeah.
That's all I'm saying, just if they can
Right.
come up with something that would stop the
Right.
pain.
So one of the things we have discovered is that we can't necessarily, as you say, get rid of the virus, and it's very difficult to cure the pain. So what we want to try to do is minimize the outbreak and minimize the pain that you experience, minimize the rash, and hopefully maybe even just stop the disease from happening at all. And the way that we do that is through vaccinations. So what is a vaccination? So if you think of your body's immune system as a factory, and the factory's job is to produce antibodies to fight against disease. That's its job. Well, how does it get the blueprints for these diseases? If it's a factory, it needs blueprints to be able to figure out how am I going to fight this disease. It gets the blueprints in a couple of ways. Through nature, we're exposed to things all the time, and our body recognizes it and says, oh, this probably isn't any good, I'm going to figure out how to fight it. And it stores that information away in the factory, and if we see it again, it's ready to fight it. Well, sometimes it takes a long time for the body to recognize what's bad for it, and by the time it figures out how to fight it, we're really sick. So we want to give the body a jump start. We want to give that immune system some blueprints about how to fight this disease state before we get too sick. So that's what a vaccination is. It's basically introducing something into your body that gives that immune system some blueprints. So as soon as it sees it, it can jump right in and fight it and hopefully prevent the outbreak or minimize it. That's what the Zostavax vaccine is all about, is teaching your body how to fight against the disease. So the Zostavax vaccine is unique in that it is a live virus that we're putting into your body. It's not a dead virus. However, it's been altered in such a way that it won't cause disease in a fairly normal human being. If you are being treated for some sort of disease state where your immune system is being suppressed, maybe you have cancer and you're going under cancer treatments, maybe you have asthma and you're on high doses of steroids, you want to talk with your doctor about whether or not it's the right time for you to get this vaccine, because there is a risk you may actually induce the disease. If you are allergic to any portion of the vaccine, if you've ever had a problem with any vaccine at all, probably should find out what is in that vaccine that might have caused problems for you. Talk to your practitioner and see if it's right for you. You do have time to make a decision about this. Make an informed decision before you go ahead and get the vaccine. Are there any questions before I go? Yeah.
Is that a one-time vaccine?
Yeah, at this point, it is a one-time vaccine. They haven't done many studies further out to see if you need a booster, but at this point, the CDC is saying it's a one and done, one time. And it's recommended for people over 50. Now, between 50 and 60, usually it's associated with some other sort of disease state where they really want to help prevent you from getting the shingles. And then after 60, it's fairly standard. They are doing studies now that show the earlier you contracted chickenpox in your lifetime, the earlier you might outbreak with the shingles. So that guideline might change, I don't know, but at this point, CDC recommendations is 50 to 60 with comorbidities, 60 and after is standard, one and done. Okay.
What do you mean by one and done?
Oh, I'm sorry. It's a little slang that we pick up in the pharmacy. It means it means one shot, one treatment, and you're done. There's a lot of vaccines where you get it one time and then you're done. Where some other vaccines you need booster shots throughout your lifetime to keep your immunity up.
So what age range does it seem to target? Is it a target?
Well, we're targeting anybody who's 50 and above, who has any other concurring comorbidities, co-disease states, or 60 and above. And that's because that's when it seems to express itself. There are cases, though, where people in their 40s will get it. Much younger people have gotten the disease for whatever reason. But that's where it really seems to be. After the age of 60, the studies have said 1 in 3 people are going to come down with it in some way. Yeah.
So what makes it come alive again?
Well, that's the big mystery question. They really aren't sure why it's reactivated. It's a mystery, unfortunately, that they are working on, and they think they know some of the answers, but they really aren't sure. They also aren't sure why it can live in dormancy when the immune system tends to clear out most vaccines when it comes into your body. There's been some studies that have shown viruses cause changes in your cells on the surface of the cell that the immune system recognizes. There's some studies saying that the shingles vaccine, or the varicella zoster virus doesn't do that. But they really aren't sure, unfortunately. So really what we're focused on is preventing the expression of the disease in such a debilitating way. It's not the greatest, but until we can cure it and eradicate it, it's what we have right now.
How soon can you have the vaccine after you've had the shingles?
How soon? I would wait until you're symptom-free. I would wait until you're symptom-free, unless your physician advises otherwise.
My physician just did give it to me,
She did, yeah.
but I still have the shingles.
Do you still have a rash?
Still have them active,
Yeah.
but she did give me, she said that should not interfere with it.
Okay. Yeah, it's a discussion to have with
Yeah,
your.
everyone's different.
Right, right. Because, I mean, you are inducing your immune system, so you really want to have that discussion with your practitioner if you have the shingles. Now, it's a very good point they brought up. They have the shingles, and they're still getting the vaccine. Well, why are they getting it?
Sorry.
Yeah.
My vaccine was for the flu, I'm sorry, not for the shingles.
Oh, for the flu.
They
Mhm.
will not give you the shingle shot until you're like 6 months clear, but then you can get the shingle vaccine.
That's what your doctor said, 6 months
I
clear?
was talking about
The flu shot, okay.
Sorry.
I'll get back to that, because that's a good point. Okay. But why would you get the shingles vaccine if you've already had the shingles? You can get the shingles again and again and again. Yeah, and it is debilitating. So even if you get the shingles, you should then vaccinate yourself to prevent it from coming back or minimize. Even with the vaccine, some people still do have an expression of disease, but it may be very minimal. I had a client who had the shingles vaccine and developed a very itchy torso, and she thought it was dry skin. And this went on for a few months, and all of a sudden, once we did some investigation, me and the doctor did some talking, realized, I bet you it's the shingles, and we put her on a short course of antivirals, and sure enough, that helped clear it up. So even though the itch was annoying, it was better than pain. So it can express itself even with the shot, but it really helps minimize the disease.
Is it considered a dangerous disease?
It's So it's a complicated question. So it's not a disease that's going to kill you in and of itself. However, it can cause ongoing pain. If you do get it in your head, it can cause visual problems. So it's a real quality of life issue. Sometimes the rashes themselves can become infected with bacteria because they are an exposed rash. So in and of itself, it's not going to kill you, which that sounds kind of harsh, I'm sorry. But the complications of it are very debilitating. And then the side effects from medications that we use to treat the pain can be debilitating. They can cause drowsiness, dizziness. Yeah, drowsiness is this lady. Yeah, and yes.
My shingles started in my hand, from my
Sure.
elbow to my hand.
From your elbow to your hand, yeah.
And it went up to my shoulder.
Up to, yeah. Right. Yeah. It's typical along the trunk or in the head, but it's not uncommon to see it elsewhere on the trunk of the body because it is along the nerve root, along your spine and in your head. So, yeah. Oh, it can be on your scalp. It can be around your eyes because it lives in the ganglia there. Yeah. So that's the risk that it gets into your eye. So let's go back to the question. There was a discussion about what other vaccines can you get at the same time as you get the Zostavax. So you can get the flu shot at the same time that you get the Zostavax. We do that on the same day. Now there is a shot, the Pneumovax vaccine, which is for pneumonia, that they do not want you to get at the same time, that you should separate those two. And the Pneumovax is a vaccine that they suggest you get after 60 as well. So if you are discussing with your doctor your vaccine profile at one of your physicals, you'll want to be sure to separate them or plan to separate them by at least 4 weeks. And that has to do with the fact that that's an attenuated virus as well, meaning that it's partially alive, whereas the flu vaccine is not.
How often do you get that pneumonia shot? Is
Then-
good for,
You know what, off the top of my head, I don't have the CDC guidelines. I think it's just the once after you turn 60, but I would have to double check. I can get back to you on that.
say for every 5 years you should.
I think, yes, you may be, I'm really sorry, but I would have to check the CDC guidelines. I'm a little embarrassed, I'm sorry. But yeah, I will check on that for you, and I'll get the answer to Roberta for you. Yeah. Any other questions? Yes. Oh, the question was on the Pneumovax, the pneumonia vaccine we were talking about. She asked me for that particular vaccine, how often do you get that vaccine? And I said, I'm really not sure. I'd have to check the CDC guidelines, which I should have done ahead of time. I'm really sorry. But I believe it is the once after 60 and then once every 5 years, as you suggested. But CDC changes their guidelines often, so I will check. I'll get the answer to Roberta.
I thought years ago it was once every 10 years, so it may have changed.
Yeah. Again, the CDC guidelines do change, and I should have brought a list with me today, but I didn't. So I'm very sorry, but I will get the answer to you. Okay. Any other questions?
And
Yes.
the vaccine can be obtained at
We do, yes, we do have, so there was some, a little bit of a mystique around the vaccine for a little while because of storage conditions. It has to be kept frozen. It is a live vaccine. We have to keep it frozen. And as soon as we reconstitute it, it has to be used within 30 minutes. So getting these approved storage conditions were a little bit difficult. So we finally did get all of our freezers in place, and we have all the vaccine. So because of the difficulty of obtaining this, I think it got a little bit of a mystique that it was difficult to get, or we couldn't get it, or maybe I shouldn't get it, but it is readily available now. And most insurances do cover the bulk of it. There's sometimes a copay of maybe, I've seen as high as $25, $30, but most insurances do cover it. So if you want to just call us, we can certainly run a claim through your insurance and find out what it would cost you and set up an appointment. I think Roberta and I are going to try to maybe develop a clinic of some kind, but because of the storage conditions, we'll just have to work out the details as to how we do that. If you can't come up to the pharmacy up the road, then I could certainly come down here. We'll just have to finagle the details. I did speak with the representative of the Zostavax vaccine. They've done some studies, and we can now take it out of the freezer and keep it refrigerated for 72 hours. So I could transport it down here to administer a vaccine. I just can't then put it back in the freezer once I take it out. So there's some limited transportability, I think that's a word, with it. So it's definitely something we could work out. Any other questions, concerns? No. Anything else while I'm here and you have my ear, anything else other than Zostavax? Am I opening a Pandora's box? Probably. Well, thank you very much. I really appreciate you inviting me here today. Thank you.
I'm Roberta Lynch, and you're watching Medfield.tv.